If you've spent even a few minutes on Instagram lately, you've probably come across a lot of content on ADHD. Reels about being easily distracted, about procrastination, about hyperfocus. While some of this content might feel validating for a lot of people, it also raises a very important question about when is it ADHD and when is it something else. Today, Lakshita and I are going to have a conversation where we slow down to assess what ADHD looks like from a clinical lens. So, if you've ever been curious about what ADHD is, or if you've ever had this question pop into your mind, come join us for our first episode of Beyond Sessions.
Good morning, Neil.
Good morning, Lakshita.
How are you doing?
I'm doing good. How are you?
I'm good, thank you. So, this will be the first episode of the podcast that we are doing from Beautiful Mind Healthcare, and the first episode talks about adult ADHD. So, I will be asking you a couple of questions regarding, what is ADHD, how does it look like for the common people, and what are the different symptoms that they experience. So, that's the plan for the day. Shall we go ahead?
Sure.
So, we'll start off with the first question for the day. Can you tell us what is adult ADHD from a clinical point of view?
So, adult ADHD is a neurodevelopmental condition. It is a condition that affects emotional regulation, executive functioning, and impulse control. It's something that usually begins in childhood, and for most people, adult ADHD is something that they experience from a very young age, but it goes undetected often. The normative pattern is that there would be inattention and a lot of hyperactivity, impulsivity in their childhood, but as they keep growing up, because of a lot of social conditioning or because of the frontal lobe developing as well, the hyperactivity, impulsivity slowly starts to come down, and it's the inattention that still persists.
Okay.
But in adults, when we talk about ADHD, there is a lot of research now that's coming up as well to understand more about can adult ADHD be something that starts in adulthood. That's one area where there is still research that's going on. Inattention is not just about simply being distracted, and ADHD is also not about simply having too much energy, as we see on a lot of content online. It's more to do with inattention in terms of selective attention and sustained attention. Selective attention is what we know commonly as hyperfocus. Sustained attention, on the other hand, is about all of the tasks that we do, such as watching a movie or reading a book, where we'll have to sit for a prolonged duration and pay attention for a sustained period of time. And hyperactivity, impulsivity is also another important part of ADHD. It's not just again about having too much energy. It's about feeling that sense of restlessness, feeling that sense of wanting to keep moving around, because the body is not able to control that urge as well. Even they try to control that urge, often it makes them feel quite stressed. So that is how hyperactivity might manifest. Impulsivity could be in terms of conversations, that when they're talking to someone, being able to take turns is a difficulty. They might have that impulse to pitch in and share their opinion immediately. So these are some ways that in which adult ADHD can manifest, and this is what it can look like clinically.
Okay. And as a connection to that, the next question is about how can we differentiate adult ADHD from our day-to-day distress and life stress?
Right. So in the environment, when there are a lot of distraction factors externally, especially with I think the advent of the internet, all of us are subjects of going through doom scrolling from time to time. So that mobile phone or devices is something that serves as a distraction. But generally, if the environment around us is quite high in terms of stimulation, then we are likely to get distracted. But with adult ADHD, it's something that happens where the pattern is long-standing, it's persistent, and you see that the impairment is there in a lot of different areas. So it's not just restricted to a high stimulus environment. It could also be that they are sitting and they're trying to focus and there's no noise, but they could be distracted by their own thoughts or associations as well. So the pattern is not something that is restricted to one place or to one domain of their life. It's something that they see is repeatedly happening and recurring in various areas.
And why do you think proper assessment is required before we diagnose with ADHD?
So there are a lot of other mental health concerns, a lot of other conditions as well that can have an impact on our executive functioning. For example, let's say if there's chronic stress or anxiety that somebody experiences, then the amount of load that your executive function can take is quite limited. Now, if there is anxiety and stress, that's also one that is also that is also going to affect that part of your brain. So that's going to have an impact on how much you're able to pay attention, how well you're able to plan certain things. So why it's important for us to go through proper assessment before giving a diagnosis is to see that if it could be another comorbidity or it could be another condition that the client is experiencing, then we can tailor make an approach that might better suit what they are experiencing. So the kind of approach we might take for someone with anxiety or with someone with chronic stress would be very different from the kind of treatment they would receive for adult ADHD. So going through proper assessment, going through a brief case history, doing a mental status examination, having an interview with informants to assess or to get to know a bit more about their history, all of this helps us to gather enough information to know what exactly is happening. Is it just ADHD? Is it something else? Or is it a combination of things as well? So it helps us provide it helps us tailor make an approach that might help them.
Okay, all right, okay. And while speaking, you mentioned something related to informants, right? So could you help us understand a little bit more about who is an informant and why is an informant interview important to us while we do an assessment for it?
Right. So an informant is usually a parent, an elder sibling, or a friend or a partner who's known the client for a long duration. We prefer a family member like a parent or an elder sibling who would have seen them in their formative years, so that we're able to assess a little bit of history about their birth and development, how things were in their childhood, how were they functioning socially, how were things academically, what was the kind of feedback that parents would often receive from school, from these PTM meetings. So it helps us assess what was the pattern like from their childhood. Now, the reason why this is important is because if there is underlying anxiety or if there is underlying depression or substance use or anything else, then the pattern would be a little different. And sometimes for a lot of clients, it's also the idea of how adult ADHD sometimes could also have an impact on your memory. So so a lot of clients would not recall some of the things from their childhood, or they might not know how certain things manifested. So getting in touch with an informant gives us the data, helps us understand how things were back then, and they can give us more clarity, give us more examples about how it would have an impact on them. So this is where this is the role that an informant usually plays in adult ADHD assessments, and it's a very crucial part of an assessment because a lot of clients may not have that insight. They may not be able to recall examples. They may not know how else it's manifesting. They might see things from a first person point of view, but others around them would have seen that happening in a lot of other situations too. So that's one way that's the role that an informant usually plays in these.
I think going ahead with this clarity, these days a lot of adults who have a lot of awareness regarding adult ADHD, and if they connect themselves to a lot of symptoms. So could you also throw some light on why a lot of them have been going ahead with the diagnosis, and why is there something like that being given to them?
Right. So one quick answer to this would be social media. So a lot of people are getting that awareness about what adult ADHD is. So like I said, sometimes for a lot of people, they may not follow that typical pattern of ADHD. So parents might not know it. For some people, for example, women, the way hyperactivity manifests in women would be very different from how it manifests in men. So we usually have this idea that someone with ADHD is, they might look like someone who's had like 10 cans of Red Bull and they have so much energy. But often it manifests in a lot of different ways. The lived experience for everyone is different. Now that there's a lot of research that's being done, mental health professionals are also getting to know a bit more about it. And this research is also helping us understand how it is manifesting in different areas. What is the different levels of severity of ADHD that people can experience.
Okay.
And I think social media is one catalyst here that's helping a lot of people get aware about it, that this is what they are experiencing, and they're reaching out for assessments now.
Okay, all right. And as a clinic, on a holistic point of view, what are certain things that do you think we provide with the diagnosis for adult ADHD for clients coming in for that?
So most clients do go through an initial psychiatric evaluation so that we're able to rule out other comorbidities.
Okay.
Now, with adult ADHD, if there is underlying anxiety or something else, then we do let clients know that we'll have to try and assess a little bit of that, because these anxiety or mood symptoms might be masking their ADHD at the core of it. So trying to work through that for a few sessions in therapy, and then considering getting an ADHD assessment done. So that's one way to go about it. A lot of women who come for assessments have this fear that what they are experiencing might not be understood because it's not represented as much as well in research or in formal academics.
Okay.
So we do try and ensure that that's not dismissed. The symptoms that they are experiencing is not dismissed by covering a brief history, doing a mental status examination, checking their current cognitive functioning, doing an informant interview as well to understand how things manifested for them. And then if required, we also do various other assessments if we have to screen or if we have to understand they're a little more in depth about the executive functioning. Then we do a scale that's called Barclay's Executive Dysfunctioning Scale as well. Barclay's Deficits and Executive Functioning Scale. So these are some of the things where if we feel like some data points are missing, then covering and using this holistic approach, it helps us understand on a deeper level how things are manifesting for them.
Okay.
So these are some ways that we try to make sure that we're taking care of their lived experience, while we're also ensuring that clinically we're doing what we have to do in a more evidence-based approach.
Okay, all right. Okay. Thank you so much. Now that we are towards the end of this particular episode, I think there's been a lot of insight and understanding from a clinical perspective, since you extensively practice with clients with concerns of adult ADHD and related symptoms. So thank you for giving us that insight and sharing the right kind of information from evidence-based point of view and otherwise. I'm sure it would have helped a lot of people gain clarity, the right kind of clarity and awareness to understanding themselves better and seeking a professional. So it was a good time talking to you. So thank you so much, Meera.
Thank you.